Dear students, as part of our modules, today we will be focusing about the child population, how over a period has started showing a declining trend in response to the demographic transition that has come in a country like India. As we know that given the development that started percolating as reflected through industrialization, urbanization and modernization, one of the important aspects is about the reduction in fertility. When the fertility is responding to these changes in the society, its impact is clearly seen in terms of childhood population. So, in that regard, the effect on children in a society, given the transition of demographic aspects that are occurring, is a very important point for all of us to understand. As seen earlier, that prior to industrialization, the traditional families, given their high dependency on agriculture and also the way in which their low socioeconomic conditions like high illiteracy and their economic status to be very low, these have individually or cumulatively have made an impact on the factors which started influencing on the fertility levels. Now, when the response to industrialization, the first and foremost is the reduction in mortality. Thanks to the positiveness that comes out due to industrialization, the medical technology, the health improvement in public health measures and immunization, they all have a clear-cut effect in reducing the mortality. So, the response in reduction starts in the mortality, followed by slow but yes, considerable change in the fertility rates. In this regard, the number of children a couple have over a period of time start showing its decline. For instance, when we talk about a total fertility rate, the total fertility rate, which was as high as 6 to 8 per woman during her entire reproductive period, started showing its decline, coming to around 4 to 5, further coming down to 3 to 4 or coming to 2 or 3, now it is 1 or 2. What this clearly indicates that the number of children in our society and their proportion in the total population is considerably coming to a declining trend. Now, given this, it is very important to focus on how the child development is taking place in response to the demographic transition that is occurring in countries like India. This is a very important aspect because children are tomorrow's partners of development and they are the future for any society. And in view of these things, we need to understand how the childhood population, when they start declining, and the aging population, when their proportion is increasing, what type of systems are placed for the development of children and what are the issues that we need to take so that the country will have a good quality among their children. As you all know that India is home to the largest child population in the world. In fact, the issues related to children are so heterogeneous, we need to have a special focus on attention for bringing up the children and also to see their child rights are taken care of in our society. The development of children is the first priority on the country's development agenda, not because they are the most vulnerable, but because they are supreme assets and also the future human resource of the country. In other words, different plan periods have clearly underlined the fact that the future of India lies in the future of Indian children across income groups, geographic locations, gender and communities. And way back in 1974, we had a formulated national policy on children. And in this regard, very important milestone in child development is Integrated Child Development Service Scheme, and which was initiated as a major program way back in 1975. Given the vulnerability aspects of children in terms of their nutritional needs, in terms of their family care, and in terms of their quality of life of various aspects, in terms of their good schooling, in terms of their good socialization within the community, and the way in which the children have to be brought also reflects on the level of development of any society. The country's development is also reflecting through the type of attention that has been paid to children, especially for infant and early childhood, is furthermore important. One of the important negative aspects in a country like India is that the infant mortality rate, which was as high as more than 125 to 140, has started showing a declining trend. No doubt it is a positive sign, but still, if you see the current rates of around 40 per 1000 live births, the infant mortality in developing country like India, still it is very high. There is a greater scope for further reduction in this, and furthermore we have to emphasize that the children's health should be the supreme intervention for attaining these aspects. In this regard, we also should know that given the mother's role in the child development, especially in the early ages, that reproductive and child health care is one of the important things which we need to promote. If you see, most of the developing countries, they have a major emphasis is on reproductive and child health for a simple reason that children constitute a major age segment, and also the high maternal mortality that exists among mothers during the risk for them during their reproductive exposure to reproduction is one of the important aspects that requires urgent attention. That is why if you look at various ministries in developing countries, the major focus of these countries in allocation of the policies, in resources, and also the action plans is to focus on reproductive and child health services. In this regard, we need to understand that any country, as long as the quality of care for children is at a very low level, this country's progress is not desirable to the extent that it will not show a significant development. So, in this regard, we need to understand that what is the level of nutritional and health status of the children, especially below 6 years of age, and what are the foundations that have been laid down for their proper psychological, physical and social development of the children, and what type of interventions have been worked out in the field of mortality, morbidity, malnutrition, and as part of social development, we need to focus on the school education for these children. And especially given the gender differences that exist in the case of children, furthermore it is important that we need to bridge that gap, and we need to see that equity and equality issues related to girl children are also emphasized. One of the important aspects in the case of gender difference is that there is a very high preference for male child, and also in general the value of children also is very high in developing societies like India. And given the preference for male children, the girl children are continuously neglected, not only in terms of one dimension of their living, but also in terms of declining access to them for education, for proper health, and also in other needs that any individual child requires for proper growth in the society. And in that regard, the response from policy, programs and schemes point of view on a continual basis we need to emphasize in these societies. In that sense, the girl child will get adequate attention and proper place in the society. So, given all these things, we need to understand a program like Integrated Child Development Scheme, because there is a recognition that one component of child focus is not comprehensive. We need to attempt in a more integrated way through optimizing various resources and also taking care of several needs and emphasizing on a particular program, but on integrated way. In this regard, the ICDS scheme, which has 6 components, for instance, supplementary nutrition to children, non-formal preschool education to children, immunization for children, health checkup for mothers and child, referral services beyond their competency to the nearby health services, and also emphasizing on nutrition and health education. These are all very important for the growth of the child and also to reduce maternal mortality and infant and child mortality in the developing countries. And as we discussed, supplementary nutrition, major emphasis of providing this is that at least some nutritional component, if it is provided by the other stakeholders, in addition to what family can support, it will greatly enhance the nutritional standards for a child. And we know very well that the nutrition plays an important role in the development of child, and also it has a major emphasis on how child responds to education and also in his or her growth. Similarly, non-formal preschool education is very important as a stepping for proper education. So, preschool education will provide access to the various education materials in a non-formal way, and that the child will get little comfort and also acceptance of the child later for proper school education will become much easier. That way, the process of bringing a child and connecting to school education will become much more comprehensive, and also it will provide a greater emphasis of child development. In this regard, another aspect is about immunization. Immunization, as it prevents several diseases, it is very important to provide immunization services for the child. Given various diseases that comes, it is very significant to emphasize on immunization programs. That is also one of the programs that is linked with the ICDS scheme. Regular health checkups is a need of the hour. Unless we have a proper checkup, it becomes a very difficult. If it is diagnosed at later stage, then the child and mother will face difficulties in accessing to proper health services. At the same time, we also need to have a proper referral services. Beyond the competence of the primary healthcare service, we need to see how best the referral system can be strengthened so that the first level of medical contact will lead to the proper connecting to the advanced and tertiary care in the healthcare system. This is also another important aspect as part of the ICDS scheme. Also, we need to emphasize on nutrition and health education for mothers and also for the community at large, because the child and mother's health plays an important role, and in this regard, all preventive promotive aspects are also have to be emphasized. In that regard, nutrition and health education plays an important role. The 3 services, namely immunization, health checkups and referral, are delivered through public health infrastructure, starting from health subcenters, primary and community health centers under the Ministry of Health and Family Welfare in Indian government setup. Another important dimension which we need to know as part of child development is child sex ratio. As we see that sex ratio in general is not in favorable conditions for girls. And furthermore, the child sex ratio also is a very important indicator to reflect on the facilities that are provided for the growth of the child. So, the child sex ratio, given the extent of neglect in the society for the girl children and denying access to proper health and proper education facilities, sex ratio is not in favor of girls, and it also clearly indicates the extent of neglect, abuse, and also denying the access to modern facilities, and also for the parameters that can reflect on the child's development, they are not in favor of a girl. And especially furthermore, it is very important in a developing country like India, where the girl child is highly neglected. If we look at most of the states, even within India, it is very clear there are huge variations exist with respect to the sex ratio in our society. However, it is very positive that sex ratio is highly favorable to girls, especially in societies like Kerala and also some of the prosperous states like Maharashtra, Gujarat, and most of the southern states, for the simple reason they also reflect on the extent of care that is provided to girl children, and also irrespective of sex, how the preference for number of family members and family size is considered by the couple in a society. In that way, they also contributed factors for successful completion of the demographic transition in these states. What clearly indicates that the data, for instance, National Family Health Survey, which has been carried out for every 5 years in several states, and also over a period of 5 years, the data clearly shows that the indicators like number of children under 5 years who are stunted. For example, stunted is an indicator which has been worked out for height for age. Similarly, for example, wasted, which is worked out for weight for height. Similarly, the severely wasted, another indicator for weight for height. Then the underweight, which is weight for age. These data, which are very, very important for measuring the child nutritional status, this data has been provided by National Family Health Survey at different rounds, and the latest survey of 2015-2016 also clearly reveals that there is a huge differences in child status in terms of nutritional conditions between urban and rural, where to a great extent urban children are at a higher advantages compared to rural areas. And if we look at the stunted number of children who are stunted based on the measurement of height for age, it is to the extent of 31% in urban areas, whereas it is as high as 41.2% in rural areas. Similar is the case with regard to underweight children. For example, children under 5 years who are underweight measured from weight for age also reflects that the urban areas, the proportion is slightly lower to the extent of 29.1%, whereas in the rural areas it is as high as 38.3%. What this clearly reveals? The data clearly reveals that our children are having the nutritional standards at very low, and also there is a need to bring the gender differences, and also the rural urban differences are so huge. We need to strengthen our medical and health and other infrastructure, especially in rural areas, so that the change that is there in these societies can be attainable over a significant time with a time schedule, so that the rural areas can also respond in bringing up girl children to a great extent. One of the important aspects which we need to emphasize is the data based on the latest census of 2011. For instance, the census 2011 data showed that there exists a significant declining trend in the child sex ratio, which is calculated as number of girls for every 1,000 boys between the age group of 0 to 6 years, with an all-time low of 918 in 2011 and which has further reduced when we compare to 1961 of data of 976. The decline in child sex ratio is unabated since 1961. This is an alarming indicator for women's disempowerment. It reflects both pre-birth discrimination manifested through gender-based sex selection and post-birth discrimination against girls. The decline is widespread across the country and has expanded to rural as well as in tribal areas. Alarming by the sharp decline, the Government of India has recently introduced a scheme called Beti Bachao. Beti Bachao is a program to address the issue of decline in child sex ratio in 100 gender critical districts. Coordinated and convergent efforts are needed to ensure survival, protection and education of the girl child in these societies. What clearly reflects is that when the data is clear that there is a huge discrimination which is not conducive for child sex ratio and also widespread variations in their access to children, to education, schooling and other social developmental indicators, it is very important to evolve suitable policies and schemes so that there will be a greater emphasis in uplifting the status of girl child and so that we can bridge the gap that exists in the gender differentiation with respect to the various developmental parameters. The government has adopted a new national policy for children in 2013, another significant towards policy response as reflected through this national policy. The policy recognizes that every person below the age of 18 years as a child and covers all children with the territory and jurisdiction of the country. It recognizes that a multi-sectoral and multi-dimensional approach is necessary to secure the rights of children. The policy has identified 4 key priority areas: survival, health, nutrition, education and development, protection and participation for focused attention. As children's needs are multi-sectoral, interconnected and require collective action, the policy calls for purposeful convergence and coordination across different sectors and level of governance. In that way, this is a very significant step to accept that there exists a huge gap with respect to gender, and in a multi-sectoral way we need to focus on this. Similarly, based on the national policy, the ministry developed a draft national action plan for children. The plan of action has been drafted keeping in view the existing schemes and programs of various ministries. The purpose is to track and monitor the progress of what is already being done for children across ministries and sectors. What clearly indicates with respect to the data, with respect to the response towards policies and programs, with respect to children and mothers, there is a clear-cut pathway which can influence very significantly in optimizing our resources and focusing on child development. That is why the quality of child in terms of having a proper access to health, education has started no doubt over a period of time thanks to the developmental efforts that started, the response of the policies and the suitable evaluation of suitable programs have started showing its significant difference. Given the heterogeneity and diversity of the country, it is a long way to go how best all the states can have a clear-cut response to these things. Besides the response from policies and programs, it has a huge cultural variations and also the response from socio-cultural dimension, especially from the communities, is very much required. In that way, the education for couples, community change agents and also other stakeholders who are associated in community development is required so that they all will understand and respond favorably in addressing the child related issues in addressing the reproductive and child health programs, and that way the child will not be neglected, and over a period the child development can be optimized. And as we clearly seen that the major emphasis on children, when we are proposing that these programs will definitely address these needs of the children so that they come up as a good adults, so that the future of the country's development will be based on the quality of care that we are providing to children of today. In that regard, if we look at the demographic transition in the developing countries, no doubt it is very positive that it is to a great extent we moved from first stage of demographic transition, which is a characteristic of high fertility and mortality, which started showing its change in the second stage, where the response to this developmental process is significantly with respect to mortality, but slowly but significant steady decline later in the fertility. And in the third stage, where both fertility and mortality started showing its declining trend. So if we look at the country as a whole, no doubt India is in the second stage. However, given the diversity and heterogeneity that exists across different states, we are very happy that most of the states have successfully completed the second transition stage and moved to third stage. So in that way, we can say that to the great extent, the transition in the demography is very, very positive in a country like India. Though the country has a huge population, the response to these changes are highly desirable and positive, and we can be optimistic that we are able to stabilize the population to a great extent, and we can look forward for seeing that our children and the elders, through various responses from the programs and policies, can bring a good change in quality of life of these people, so that the country's overall development and the people's participation to a great extent can be attained.